It's a good day for NHS staff who will benefit from this pay rise, an extra over £5,000 for a band 6 nurse or paramedic or midwife. So it's a good day for NHS staff, but it's also a good day for patients. It will allow us to move forward. Now the NHS Staff Council has ratified this deal. It's been accepted by the majority of the NHS Staff Council, and we can now move forward, focus together on patients, and also ensure that staff get the pay rise much sooner than would have been the case under the pay review body process.
Are you going to get back round the negotiating table, or is this the final offer?
Well, it is the final offer, and it's important that those unions recognise the collective decision. This was a decision taken by 14 health unions. They reached a majority decision. It was negotiated collectively. The RCN were at the negotiating table. Indeed, Pat Cullen recommended this deal to her own members.
I think for me, the important things to remember is actually the government, who initially refused to talk about pay at all, came to the negotiating table after strikes predominantly by the RCN. We also had some strikes at Guy's and St Thomas's and some smaller ambulance strikes around the country as well. But a relatively small number of those 12 to 14 health unions actually went on strike to get this offer. So I don't think it at all means it's over. The vast majority of the health unions did accept it. However, that in itself doesn't mean that NHS workers think it's a fair deal. It just means they made a pragmatic decision to get that lump sum because they need to pay their bills, because NHS workers are that desperate, which is really sad in the first place. So the most important thing now for the health unions as a whole is the RCN reballot next month, because if the RCN can get an aggregated national ballot to go on strike, that's a huge and that has a huge impact, and I think will force the government back to the negotiating table. When I was out campaigning, trying to get other nurses to kind of vote on the deal, the two main things I heard were, I can't afford to strike because I've literally got £0 in the bank. And the other thing was, well, the government have said that they'll retract this offer. They can't do those two things anymore because now everyone has got a little bit more money because of this lump sum. So actually, if we win our fresh strike mandate, I think that puts us in quite a good position to mount some really effective strike action. And I think a lot of people are seeing this deal for what it is, and recognising that actually the fight isn't over. I also think having that, there's no longer the threat of this offer being taken off the table because it's been imposed, it's been enforced. Again, the government have lost their leverage there. So I think if we do reballot, it puts us in a strong place to mount an effective campaign. And I think it's recognising, remembering why we're doing this in the first place, and recognising why this deal goes nowhere near to fixing the staffing crisis that we have in the NHS, and that ultimately our goal is that we can safely staff the NHS. It's a testament to strike action working, because the government initially said they would not talk about this at all, and they said that was a red line, they weren't going to budge, and they have. And although it's a poor offer, it is still improved on the offer that was there before. So there is a victory that has been won by strike action, like I say, predominantly by one main union, but also some of the ambulance trusts as well.
It's definitely not all over. Ultimately, time will tell, but we are confident. We have members who have already been balloted and who have mandates that are live until September. So we are looking at issuing new notice for industrial action in those areas. But as well as that, because of the results that came back from our consultative ballot, which were disaggregated, we're able to look at where there is particularly strong support for action, and we'll look to ballot in those areas. We do have some mandates that run out at the end of May, and we will reballot those as well. But I think the biggest test here is the mood of the members, and for me, the fact that people are joining our union now, specifically so that they can take strike action, tells you all you want to know. The government should take absolutely no credit from the vote at the Joint Staff Council. This is by no means over. We are getting staff from the NHS, and we are talking about anybody from security guards to physiotherapists to nurses to speech language therapists, pharmacists, joining Unite now, because we refused to recommend this to start with. We were the only union in that position, and because we are now preparing to take further industrial action. We knew very early on that there was something wrong with these proposals. A one-off lump sum pays one bill, and that's it. And no Unite member was ringing me up and saying, this is a really fantastic deal, hurry up and sign up. Instead, I was getting Unite members ringing up and saying, we can't possibly agree to a non-consolidated lump sum. The 5%, well below any measure of inflation you want to take. But the other thing that's causing our members concern is where the money is coming from. The government said this would be new money. And now you look at the language coming out from Steve Barclay, is saying that frontline services will not be impacted and they'll be working hard now to get the money from the Treasury. That doesn't fill me with huge amounts of confidence. If you're having to work hard to get the money from the Treasury, you haven't secured it. And secondly, it's not enough to say that frontline services will not be affected, because prevention services in the NHS are just as important. It's about not getting people into hospital to start with. And we don't want to see prevention services being robbed in order to pay for this pay deal. Our view is that this is about making different political choices, finding the money from where it does exist in huge wads in sacks. Take the 170 billion in excess profits that the energy companies are going to be making over the next 2 years. How about taking 50 billion of that, using that for the NHS, and do you know what? You'll have change left over to pay for other areas of the economy as well.
I think even Unison members who voted to accept the offer haven't accepted it because they're happy with the offer. They've accepted it because Unison didn't seem to be organising any alternative in terms of fighting for more, and therefore take the bird in the bush rather than the bird in the hand rather than the two in the bush. But it doesn't mean people are happy. People are deeply, deeply unhappy about the fact that their pay has continued to go down. And most of them are really, really supportive of further fights over pay, and are supportive of the Royal College of Nursing and Unite in their fight to continue to get more. And you know, we will do everything that we can as Unison members to support that on the ground. And I think there is huge support for it. But also, I think in Unison, we will probably be looking at local fights. So there is rebandings that we can apply for. There's recruitment and retention premiums. So the fight over pay is not over. I think the government is desperate to make the strike action in the health service go away, because what it does is it exposes the level of anger and distress about the state of the health service. It exposes the 13 years of neglect that they've done. It exposes that they haven't got any solution that health workers are convinced is going to work, and therefore they've got to, that the pressure and the spotlight is still on them. And I think that that's not going to go away as long as strike action is on the cards. And I don't think sort of that they can escape the scrutiny that they've been put under for the serious, deliberate neglect that they've made of the health service and the deaths that occur on a weekly basis because of it.
How can Unison change? How can Unison keep its members or attract members like Unite seems to be doing now?
I think people in Unison are joining unions that are going to go out on strike and are balloting in order to be part of those ballots, in order to be part of the strike action. And I think Unison will lose members because of it. And I think unless Unison begins to increase the amount of action and campaigning and activity, including strike action, that it takes in order to win genuine pay rises. We have had 13 years of pay cuts. That's year after year after year. We can buy less, right, whilst we're working harder. And that is, you know, if unions don't deliver real pay rises, which means above inflation and getting some of that money back, then I think unions will become less and less relevant to their members. And that's a danger that I think Unison in particular faces unless it begins to recognise properly that the anger that exists wasn't reflected by accepting means we're happy of the pay offer. Accepting means that we think we've got no choice because you've told us we've got no choice, and therefore we've done that. Union officials were not allowed to say that they didn't think the offer was very good. They had to put the official line or do it as individuals. And that meant that the word didn't even get about some of the real sort of drawbacks of the offer.
even today, I tweeted something about being in Unison and immediately get back tweets saying, "Oh, Unison were the first to fold." Somebody said to me, other people are like, "Why are you in Unison? You should go to a different union." And so I do think that there is definitely a lot of truth in that, that people will be switching to another union. Yeah. When you go out and talk to members, which I did quite a bit when we were talking about the pay offer, nobody says that was a good pay offer, and nobody said that is everything that we deserve. And I think that members voted for it because they're so desperate for the money, and you know, they were told by the union that that's all they could get, and they trust their union. I think people do want that money, but you know, there's not a huge amount of excitement about it. I think people are just, you know, very hard up is the long and short of it.
Even though GMB members have accepted the deal, I don't think the story ends there. I think there will be a lot of battles now upcoming in the NHS, including within GMB Union. We have outsourced workers already taking strike action in South London and Maudsley. They've put in a big pay demand. They want sick pay and all of the other benefits that they should be entitled to enjoy working in a hospital. So I think a lot more battles will break out. I think the national strike action has left us with a bigger activist base across the country than we ever used to have in the trade unions. I think we've got a lot more engaged, committed activists now who are more knowledgeable than before. But I do think that this needs to be built further. We have the NHS is the largest employer in Europe. So a lot of work still needs to be done to make sure that every single workplace across the NHS and the ambulance trusts are bastions of trade unionism. Basically, those unions are visible. I do think all of the health unions need to work together, both at grassroots level. There's 14 health unions in the NHS. Every single union has very, very good committed activists. And at the end of the day, a trade union is as good as the activists within their workplaces. So I would encourage people not to hop from one union to another and back again, but to stick within their unions and try and fight to change things and make sure that they get active in the unions, in their hospitals, in their ambulance trusts, and build those structures around them, you know, for the battles to come, basically. I think that's starting to happen, but we need to see a lot more of that. I think NHS staff across the grades now, whether they're clinical, whether they're ancillary staff, are actually in a situation where they either have to leave or they'll have to fight. It's as simple as that. And the people who do leave, what we find is that they go to other hospitals or other places, and it's the same or even worse. So people have no choice but to fight. And the way you do that is you get active and involved in your trade union, as I've already said. And it is worth taking the time. The other thing we have to remember about these NHS disputes as well, it's not just about pay. It's actually about the future of the NHS itself, because if staff are being driven out, that means there aren't enough people to care for the patients, and services fail, and then they're softened up to be either outsourced or privatised, or they go completely. So it's a fight for the NHS and for free healthcare in this country as well. It's very, very important to remember that.
The BMA, the junior doctors, are still holding their position. They haven't caved into any pressure from Steve Barclay. Why are the unions weakening their own position by not working together, by not coordinating industrial action? So that to me is a big problem. And that is, Steve Barclay is trying to psychologically trap members of these unions into thinking this is as good as it's going to get. Well, that's a tactic. They need to carry on fighting, because the point of the wage suppression is to hand over a cheap workforce for the private corporations that are taking over. It would be great to hear more union representatives and leaders make this connection. Why they steadfastly refuse to make the connection, for the life of me, I do not understand, because it will resonate with the public. The public still don't have a clue about what is the overarching political goal with the NHS. They don't understand it. And the other point to reinforce is it's not about money. Paying for a good health service is very affordable. It returns money to the economy. It returns people to the workforce. And we know that the government at the drop of a hat can create billions, as they did to bail out the banks, as they did to privatize the response to the pandemic, and as they did to bail out the companies when Liz Truss had her disastrous few days as Prime Minister. So the money is there. The unions need to develop a spine. Certainly some of the unions are better than others. Unite and the RCN seem to be doing better than the GMB and Unison. I think it's important that people do change union. If your union is pathetic, then go to one that's prepared to fight. Unless we fight, we're going to end up in a situation where it's routine for people to, die languishing on waiting lists or not getting treatment in busy A&Es. Well, that is already routine, I'm afraid. If we're going to reverse that, then we need to start by stopping the hemorrhage of staff out of the NHS. And the current offer that's on the table may slow down the torrent, but there's still an exodus of experience out of healthcare.